Hi, everyone. I'm Dr. Mark LeMay, and welcome back to part 3 of part 4 in our Heart Health Month. We have Shelise Irby here with us today. She is a registered dietitian, and we were talking a little bit earlier here about how back in September of 2019, we both attended a seminar over in Oakland. It was the Botanical Wonders from Down Under, and we got to see a great clinician there by the name of Barris Burgoyne, and she talked specifically about heart health for women and how the presentation between a man and a woman is just totally different. And Shelise, when she was going through all of her training, they did a lot of studying on how, heart disease and diet really affected a person. So Shelise, why don't you go right into that and kind of talk more about like the difference between men? And then I'll come back and we'll talk a little bit about the difference between women and their presentation when it comes to heart health.
Yeah, that sounds perfect, Dr. LeMay. Yeah, so when I went to school at UC Davis for my dietetics degree, the two main diseases that we focused on for my medical nutrition therapy were diabetes and cardiovascular disease, because they are the most influenced by nutritional intervention. And so Dr. LeMay is right. And something that I did learn in school is that many of the old studies done on cardiovascular disease, the long-term studies, only included men. There are absolutely no women in the, studies that we looked at from, the 60s and 70s, even some in the 80s, until the idea that cardiovascular disease also became something that, oh yeah, women can have that too. And then it started being more closely evaluated because the presentation is different. But I'll talk a little bit about what it might look like in men. And remember, it could also look different depending on your ethnicity. So if you are of a different ethnic background, you might want to look at what might be specific symptoms that apply to you. We don't have time to really dive into all that today, unfortunately, but it is important to know. So for men, according to the CDC, in 2017, about 1 of every 4 deaths could be related to cardiovascular disease. And so that's in men only though. And so it's important to know, what the signs and symptoms are and what the comorbidities are, which means that if you have this other diagnosis, then you are more likely to get cardiovascular disease. So for men, it's mainly things like, obviously, a heart attack is going to be an indicator of cardiovascular disease or cardiovascular stress. Chest pain, discomfort. In the movies, we have this classic symptom of the guy, grabbing his left arm and it's very painful. It's not always like that, but it can be. It can be very painful. You get shortness of breath. You could throw up. You could vomit, have nausea. You can have dizziness. Any sort of, that's like more extreme, right? If we're in an actual heart attack situation. The less extreme symptoms that we could have recurring as a male that could indicate we have cardiovascular disease are things like arrhythmia or AFib that you might be diagnosed with, but you might not really know about it. It's just, some people describe it as like their heart feels like it's beating out of their chest or it's beating too fast, or some people say their heart is beating too slow. And they can feel their heart. You shouldn't be able to feel your heart beating typically, unless you're exerting yourself, very, very like physical exercise. So if you can feel your heart beating at rest, it's not a great sign. That could indicate that there's some cardiovascular stress there. So the other thing to think about is fatigue, just general shortness of breath, fatigue, difficulty on exertion with catching your breath, swelling of the feet or ankles or legs. Those can all be challenges that could indicate you have cardiovascular issues. And then I also talked about comorbidities, which are the things that you could be diagnosed with that might indicate you are more likely to get cardiovascular disease. For men, those are diabetes, overweight and obesity, unhealthy diet, lack of physical activity, and excessive alcohol use. So all those things, if you do them, or if you are diagnosed with one of those other diseases, then you are more likely to have cardiovascular disease in your lifetime. So we didn't talk about this yet, but also history of it in your family can be a cofactor as well. So that's kind of what we're looking at for men in regards to cardiovascular disease signs and symptoms. But honestly, the number one that I see with the patients that I have tested is just general fatigue. If the heart isn't working optimally, you're not going to get enough oxygen to the brain and the far areas of the body away from the heart, your feet and hands. And so you're going to have general fatigue, inability to maybe have proper circulation, things like that. So that's like the number one thing to look for. And I know like 90% of you out there watching are like, well, I have fatigue. So it's something to be aware of and to think, oh, if I have someone coming in and their main complaint is fatigue, I'm always going to look at their heart as well, part of their evaluation, to make sure that we rule that out at least. But now Dr. LeMay is going to talk more about how females might present with cardiovascular stress.
Thanks, Shelise. And a lot of those symptoms that you were talking about for men, they're fairly similar to women also, except for one of the things that I noticed in their symptomatology is they showed that a lot of them had shortness of breath during the day and at nighttime. They were having shortness of breath. But almost all the other things were very similar, except for the presentation for most of these ladies, because men have a general tendency when they have a heart attack, they have clogging of the large arteries of the heart, the coronary arteries, usually, so they get a total occlusion of one of their coronary arteries. Women don't get that typically. They typically get what they call more like an ischemic, incident, because again, the small blood vessels that go to the heart are the ones that are affected, not the large ones. And so that's why they get like more fatigue, discomfort, they get neck pain, back pain, because these different blood vessels in the heart refer pain to these areas. Like they get jaw pain, they get neck pain, they get back pain. That's how they present. And that's basically looked at because when they test them with, like they're testing for a guy, they go like, hey, we don't see any coronary arteries being blocked up, but they're not checking the small arteries of the heart, which is what they are starting to do now, because they're laying, oh, men have these kind of symptoms, women have these kind of symptoms, and that's what they want to do. And when we were at the one seminar, she was talking about the incidence of coronary artery disease for women. It was very interesting. So at age 40, because you always think it's like, well, this is not until people get older that they're going to have these kind of problems. Yeah. Well, that's not what they're seeing for women age 40, because it is the biggest killer of women right now. And it's like 1 in 8 women would die of breast disease, but 1 in 2 would die of cardiovascular disease. And that's at age 40. Now, when you went up to age 70, it was better. They actually had less problems with that. They went from, instead of 1 in 8 for breast cancer was 1 in 15, and for cardiovascular from 1 in 2 went up to 1 in 8. But still, that is a high amount. So that's why both cardiovascular disease for men and cardiovascular disease for women is the number one killer of both men and women in the United States today. And could you kind of talk a little bit more about how you approach this a little bit for both the men and women when you're talking to them about their heart health when you're back there doing the testing?
Yeah, definitely. And one of the other things that I forgot to mention for both men and women to look at as cofactors for cardiovascular health issues is if you have a blood panel and your doctor has said that you've had high cholesterol or high triglycerides, if you are a smoker or have been a smoker in the past, and if you have high blood pressure. So those are all things that we look at and evaluate. So when I am looking at a patient file, we do a questionnaire to get an idea of your heart health history. I also do a verbal, interview with the patient, looking at your medications, and I take everyone's blood pressure every single time before we do the test, and looking at heart rate and things like that. And so if you do have a high cholesterol challenge, then that's something that we can try to deal with from a nutritional aspect. Like I said, cardiovascular disease and diabetes are the two most beneficial diseases to have nutrition intervention. That's something that I learned in school, and that's very, very true. And so there's a lot we can do from the nutritional perspective. If you are taking a statin, there's still a lot of things we can do nutritionally and lifestyle wise to help support your heart health. So something that relates to the alcohol, excessive alcohol intake, or I would add to that the unhealthy diet and excessive carb intake, because that's kind of on my plate in regards to the food side of things, is that what you want to avoid is giving yourself a fatty liver, because that is number one going to cause issues for your heart. If you are eating excessive carbs or just excessive calories, and alcohol counts as that, then you're going to be creating a really, really unhealthy situation for your liver, and that's going to potentially increase your blood pressure and cause a lot of stress on the heart. So when I'm talking to patients in their appointment, a lot of the things that we're talking about is food changes. So we talk about having sufficient water so the blood is not is the right viscosity, right? It's flowing in the right thickness. Mm-hmm. We talk about eating things regularly that are great for the heart, like garlic, rosemary, herbs that they can incorporate into their everyday diet, eating plenty of vegetables and good fats, right? Avoiding the really unhealthy fats, limiting alcohol consumption, no trans fats or things like that. So those are how I kind of tackle it from a nutrition perspective, so that we can look at what's the best way to influence this patient's heart health and improve it the fastest. Like I have said in almost every one of these videos, I'm not a super patient person. So I want to know what's going to affect the person in front of me's health the fastest. And that's why I might recommend quite a few nutritional interventions, because I don't want to wait around for this person to have a negative experience with their heart, some sort of event that lands them in the hospital, or they pass out, or fall down and hurt themselves, because I want to change things quickly.
Okay, well, great. And you brought up a really good point just a little while ago here, because we check oxygenation of their blood. And right now we're kind of going through a period where people are wearing a lot of masks, and the masks impede airflow to the body, and that is causing their oxygenation to go down, which is a concern, because when it comes to the heart, you have to have good oxygenation to be able to have a good, healthy heart. So, you brought up a really good point there on that. And again, it's like your heart is really like the window to the overall function of your body, because we know if the heart is not functioning really well, the rest of the body is not functioning really well either. And so that's why this is also a really good way of checking out. I think I always tell people it's like when you're doing this, you're like checking the lights on your car engine. Which one of these lights are lighting up here, so we can actually address an issue before it gets to be, your whole engine breaks down, because now you've got a heart attack, and that's not good. We want to keep your body functioning well and healthy. Okay, so is there anything else that you would like to talk about that we haven't talked about so far?
I just wanted to remind everyone that we do have heart sound recorder testing available on the February 12th and March 12th. February might have already passed since we're on our third video now. So we have heart sound recorder testing coming up on March 12th. I'm up in the LeMay's office every single month to do heart sound recorder testing. And I also don't want all day long. I'm there all day, every month. What I don't want is this information to make people afraid. Sometimes when I talk about the heart, It's very scary for people. And I've had a lot of patients come in to see me to get their test done, and they're just incredibly nervous, and it raises their blood pressure, and, you know, it affects their heart rate. And so what I encourage you is, if you are feeling anxious about any of this information, or if you're concerned about your heart, like, take that anxiety and turn it into action. That's at least what I do when I'm feeling really nervous about something. I try to get my body moving and my brain wrapped around doing some action step towards changing it, because kind of just brooding about it and thinking like very cataclysmic thoughts doesn't really help me a lot. It just makes things worse. So if you are concerned about your heart, there's lots of things that you can do that are inexpensive that can help support your health. You know, if you're one of those people, I can't tell you how many patients I've had that have come in and said, you know, my dad died of a heart attack at 63, or my mom died of a heart attack at 45, you know, and they're terrified of living, you know, longer than that age, because they think that they're stuck with this fate. And it's really not true. There's so much we can do in order to help support the heart and our health overall. And that whole stress attached to all that, it's making it a lot worse. And so I'm not discounting anyone's anxiety or stress. Your feelings are your feelings, but let us help you do something about it, so that it's not this thing hanging over your head.
Right. And there was one other thing I just remembered too, is like we were talking about how young can a person be to be tested for the heart sound recorder. And what did you say again, Shelise?
I said, as long as they can sit still and not talk for about 10 minutes.
That's the big thing, is they can sit still and not talk. So it just depends upon the child, and we have to go from there.
I think the youngest person I tested was a 7-year-old so far, but could probably be a little younger as long as they're able to not make noise.
Yeah. Okay. Great. Well, thank you again, Shelise, for being with us here. And the next time we get together, what's our preview for everybody next time? What are we going to be doing?
Next time, we will have some testimonials about people who have done the heart sound recorder test multiple times. Like I said in previous videos, it's really the most beneficial as a tool if we have multiple scans to compare to each other. And so we'll be hearing about some people who have had that experience and done some lifestyle changes in order to affect their scans.
All right. Well, great. Thank you again, Shelise, for being with us here. Really appreciate your expertise in this area. And
thank you.
Looking forward to next time.
Me too.
All right. We'll see you then.